Hello and welcome to Yashoda Hospitals. I'm Prathyusha Chowdary, hosting Nursing Education and Training webinar series live on Facebook every Thursday at 3 p.m., bringing forth the most interesting topics for you. So, as usual, we have brought an interesting topic for you today that is on basics of newborn screening. The main focus will be on the head-to-toe assessment, also on Apgar. So, without further delay, let me introduce you to the pros of today's webinar. I take the privilege of welcoming our expert panelist for the day, Dr. Kiranmaye ma'am, who's the best neonatologist and pediatrician, Yashoda Hospitals, Secunderabad, with over 9 years of experience in newborn care. She is certified in lactation, pediatric advanced life support, and neonatal resuscitation. Ma'am is expertised in non-invasive ventilation and invasive ventilation. Also, she has published many of the research articles. We welcome you, ma'am.
Thank you.
I'm happy to introduce our speaker for the day, Ms. Yojana, a senior nurse educator, Yashoda Hospitals. She did her master's in pediatric nursing and have bagged 10 plus years of her clinical expertise in pediatrics and adults. So let us hear more from her. Over to you, Yojana.
Thank you so much, Prathyusha. Thank you so much, Prathyusha. So very good afternoon, everyone. So today's topic I'm discussing regarding the newborn screening, the basics, and I'm going to cover about the Apgar score as well as head-to-toe examination. So today's webinar, so I'm going to discuss about regarding the examinations. So we have to undergo a different examinations for the newborn. In this, the first that I want to explain is regarding the process of examination. The process of examination in the sense, so what is the method and how we need to go into this session, I mean like examination, as well as the second thing that I want to discuss is immediate assessment, that is Apgar score. Then the sequence of examination. So how we need to examine a newborn baby. So when as soon as the birth, then head-to-toe examination, and we need to identify the different anomalies or the defects and the nursing management. Then coming to the first thing, that is the process of examination. So the process means it is a way, there are various steps that we need to examine a baby as soon as they was born. So here, a neonate is considered when the baby was born from the birth to 28 days of birth is considered as a neonate. And so as soon as the baby was born, we need to see whether the baby was alive or not. Then later on, we in this, we will, one second. Yeah. So we are focusing on the Apgar score, which is performed 1 minute and 5 minutes after the birth. So after that, after assessing the Apgar, we need to check the newborn baby from head to toe. Next, we need to identify the defects. As soon as you identify the defects of the baby, then next we need to record the findings. So whatever the normal and also the abnormalities that you identified for the babies should be recorded in the document. And then we need to evaluate and manage the baby. Next, the most thing is the immediate assessment, which is called as Apgar. So this Apgar will help not only to identify the mortality and morbidity, but also the neurological status or the neurological examination of the kid. So this is usually performed, as I told you before, so for 1 minute and 5 minutes. If at all, the baby score is below 6, then every 10 minutes, we need to assess the baby, whether the kid is normal or abnormal. So, and this Apgar score is based on 5 criteria. That is, we are checking the appearance of the child, of a baby, pulse, grimace, activity, and respiration. So appearance. So here we have a maximum score of 2 and minimum score of 0. And the total score is represented as a 10. So if at all a baby body or a baby is appearing pink all over the body, with including the head, body, trunk, abdomen, and extremities are pink, then you need to give a score of 2. When you notice a baby having the head and the body is pink and all the upper extremities and the lower extremities are blue, then you give a score of 1. So you know that as soon as you have received the baby and you check that complete paleness or the blue all over the body, then the score will be 0. So this is about the appearance. Next, as soon as you check the appearance, you need to check the pulse. So pulse is considered as, the normal pulse is always above 100. So when a baby heart rate is more than 100, then you give a score of 2, less than 100, score of 1. You are not able to identify the pulse of the baby, then immediately give a score of 0. That means appearance is 0 and the pulse is 0. Next is the grimace. So what is a grimace? So when you give any stimuli, how the baby is expressing, that is called as a grimace. So here, when you give some stimuli for the baby, immediately the baby pulls away and she cries loudly with a high pitch, then definitely the score will be 2 because the baby is normal and patient tone is good. Next is, if at all, when you give a stimulus, the baby is having some movement with a weak cry in the sense, the voice of the baby is very low and you can't even hear this, then you give a score of 1. So you have given stimulus, there is no cry, there is no expression, then the grimace is 0. Next, let's see the activity. So here, the activity means the muscle tone of the child. So muscle tone in the sense, so you have to see whether the baby is able to flex and extend. So if the baby is having a complete mobilization of the arms, like they are irritating, or so they are pulling themselves, pushing themselves and having all the activity of the body, then give a score of 2. So sometimes when you take a baby and make the baby in a supine position, only the arms and legs are flexed, but you are not able to see any extension, then give a score of 1. No movement at all, no flexion, no extension, no activity, the baby is not moving anything, then give a score of 0. Next is the respiration. So here, the respiration, we are not counting how many respirations the patient is, means like it is 20 or 60 or 50. We are not counting the respiratory rate, but we are assessing the respiration by seeing the cry level. That is, baby is having very strong cry. Even sometimes you can see as you receive a baby, so immediately they have a cry, so that even the other wards and other areas also listen the baby crying. So if you have that strong cry, definitely give a score of 2. And sometimes if the baby is having an irregular cry, sometimes he cry and slow down, cry and slow down. So we are not able to know whether the baby is crying or not. So if you have that type of imagination, or if you have seen that, then immediately give a score of 1. No breathing at all, the baby is not crying, the baby is not at all responding, then give a score of 0. So total, so after seeing these 5 criteria, you will get a score. So if your score is 8 to 10, that means baby is normal. So you can continue the post-delivery care of the baby and you can go with a regular assessment. If at all, you're getting a score of 4 to 7, that is, baby is having mild depression. When a baby is having this 4 to 7, then immediately you connect the oxygen, do suction and do simulation for the baby. So simulation in the sense you can rub the back of the baby or you can rub the abdomen of the baby. So to see that is called as a simulation. So these are the things that you have to perform when you notice a baby is having a mild depression. Then coming to 0 or 3, immediately you have to alert, that is, a patient is having a severe depression as well as the patient needs a resuscitation. So immediately have to arrange for resuscitation and do your care. Here is one scenario that I want to, put for you. So to know whether you have understood this Apgar. So scenario is, so you are assessing the Apgar score, Apgar for the baby that was born. Immediately the heart rate is 130 with pink body and cyanotic hands and the feet. Patient has a weak, baby has a weak cry and flexes arm and legs, moves actively, cry when stimulated. What is the baby's Apgar score? So you can post in the chat session. So what is the baby's score, Apgar score? So here, so when you see this, give a score for appearance as 1. Why we're giving 1? Because the body with pink, and this patient's baby hands and feet are sinus. So appearance is 1. Then pulse is 2. Why? Because the heart rate is more than 100. It is not less than 100. So you give a score of 2. Grimace, baby is weak and flexes arms and leg. That's why give a score of 1 for the grimace. And activity, in the scenario, it says that baby was moving actively and the patient is not dull there. So give a score of 2 for activity for the baby. Next is the respiration. Baby is cry when stimulated. So baby is not crying spontaneously. When you have stimulated, then only the baby is crying. So the respiratory rate is 1. Your score is 7. So 7 represent mild depression. So what's the treatment for the mild depression? Can post in the comment section. Yes, that's right. So you have to go with the suctioning, oxygen support, and stimulation for the baby. That's nice. So let's see what is the sequence of examination. Usually, you have to do the examination from head to toe. It starts from the general observation. So general observation means like it is an anthropometric measurements. Next, it starts from your head and the spine, face, eyes, ears, mouth. Next, the chest, abdomen, and anus, genitalia, urinary tract, limbs, and chromosomal abnormalities. So here I'll show a video. Can anyone see this? So this is the examination as soon as you take a baby. So position is important and the sequence of examination is very important. So here they are checking whether the baby is having any cleft lip or cleft palate, and also along with this they are checking any milk teeth is present in the oral cavity. And simultaneously they are checking the nasal phrase for fingers are present or not. There is a and the palpation is very, very important while checking the abdomens, because this will help to check whether the liver and spleen and the lower part of the kidney was palpated or not. So wrap from head to foot to the genitalia, and also the lower extremities were assessed. Is considered has 2.5 to 3.5 kilograms. If the baby is having the less than 2.5, we consider the baby has a low birth weight, and above 3.5 is called as overweight. And here, even this low birth weight will be seen for the babies who are in the preterm. So while you are assessing the weight of the baby, make sure the cloths should not be present on the weighing machine. And second thing is your height. So height can be measured in 2 ways. So that is from the head to the crown to the hip. Next, from the hip to the leg, we will check it and then add the value, and we will check the height. Other one is directly we are checking the height from the crown to the heel by extending the leg. So this will give you an accurate result of the height of the baby. Next is your head circumference. So head circumference, when you are measuring, you make sure that from the tip of your, from the forehead, that is mid part of the forehead, and it should cover the occiput. So from there, you need to round up and then check the head circumference. If you're not checking the occipital, that means it is an error and it doesn't give any accuracy in the head circumference. Always make sure from the head, tip of the head, and to the occiput, you need to cover while measuring with the inch tape. That is, usually the normal is 33 to 35 centimeters. Then coming to the chest circumference, here, the chest, again, we are telling you from the tip here, the mediastinal region, from there, covering the nipples, and then you need to round up to assess the chest circumference of the baby. So when a newborn baby, so always remember that the chest circumference is smaller than the head circumference. Later on, it will change. So this is about the anthropometric measurements. And here the head to toe examination, as I told you before. So we are examining the normal and also the abnormal. So when you see the head, usually the head and face, we are checking for the fontanelles. We have the anterior fontanellus and the posterior fontanellus. And these two, we need to assess whether the shape is appropriate, or if there is overlapping and non-overlapping present, and if they are the measurement is equal or not. So this we need to check in the head and face, and also the diameter. The diameter will tells you, the head circumference will tells you whether the baby is having a huge head that represent the baby is having a hydrocephalus, and the small head may represent baby may be anencephaly. Okay, so these are the main defects that you can identify when you are checking the head circumference of the baby. Next is your eyes. So when you're checking the eyes, the length of the eyes from the inner canthus of the both eyes should be measured where they are equal or not, and the pupil reactions are equal or not. And if there is any conjunctivitis, any discoloration of the sclera should be checked in the eyes. Next, coming to the nose, and nose, as I told you before, we have to check whether there is any discharge or if there is any polyps or mass that is present in the nasal cavity. And coming to the oral cavity, check for the cleft lip or cleft palate, or the important thing is a central cyanosis. We have a peripheral cyanosis and a central cyanosis. So peripheral cyanosis means like you can see the bluish discoloration only on the extremities, but central means here on the lips and the tip of the nose will tell you that it is a central cyanosis where it needs an immediate attention for the baby. Then coming to your second thing, next is your limbs. So always check for the polydactyls or syndactyls, or sometimes there is a clubbing of fingers of the upper extremities that should be assessed. Next is your chest. In the chest, you need to check when a baby is taking the respiration, where there is a retractions or not. Where there is, if at all a baby is having a good expansion and relaxation should be assessed. Next, any heart sounds or lung sounds, abnormal heart sounds or abnormal lung sound should be heard clearly. And if at all is anything, immediately you have to intimate and take a necessary action for the baby. Then coming to the nipples. Sometimes the baby will have a witch milk from the nipples. So that should be assessed if there is any discharge, and it should be and it is a normal hormonal imbalance, it will be rectified. Then coming to the abdomen. So when you're checking the abdomen of the baby, so check whether the baby is having any abdominal distension and also palpation, as I told you before. So here the palpation in the sense you need to see at the right side whether there is any enlargement of the liver and the spleen and the kidneys. So kidneys always, for a newborn baby, you can feel the end of the liver and also the spleen, and the kidneys are the mass you need to check in the abdominal cavity as well as the umbilical cord. Usually, how many arteries and veins will be present in the umbilical cord? Post in the group, in the comment section. Usually, we have baby will have 2 arteries and 1 vein. So whether these 3 blood vessels are present or not, just you need to check it. The next is the hip for any dysplasia, and also check for the femoral pulse. Next is the lower extremities, and check whether the patient is having any club foot, and patient is having again multiple toes excuse me. So these need to be checked in the extremities. And coming to genitalia. So when you are examining the baby for genitalias, both the legs should be flexed so that it will be very easy for you to visualize all the genitalia from if it is a male or the female. So male, it is like you need to check whether the penis is present and also the testes are descended and the scrotum. And for females, check whether the labia majora, minora, clitoris, and urethral opening, everything are present or not. All the orifices are present or not. You need to check. Then later on, go to the anal region. So in the anal region, so baby is having this anal. Okay. So anus is present or not, and if it is closed or open, that should be assessed. Later on, turn the baby to the backside and check from the spinal cord, in the spinal where the baby is having any defects like spina bifida, occulta, and hematocele, any seals. So this all you need to assess in the head-to-toe examination. So this is a defects that I have explained already. So they can take an image of all these things. So this is ears, abdomen, genitalia, and coming to the defects. Okay. So how a nurse will manage a baby with certain abnormalities. The first one is a neural tube defect. If at all, while you have assessed, you notice some neural tube defect for the baby, then immediately what you're supposed to do? So you have to check the head circumference and the frontal size, protect the exposed meninges in the spinal lesion until a doctor tells you for the surgical closure. So these are the two responsibilities that you need to carry as a nurse for the neural tube defect. Next is the cleft lip and cleft palate. You need to encourage breastfeeding or palate feeding for the baby, if at all. When you are assisting for the breastfeeding, so immediately you have to encourage the mother regarding expelling, and also the position of the baby is important. So when you're positioning, always you try to make the baby head is elevator so that you can prevent aspiration, because the cleft lip and cleft palate, there is a chance of going into the lungs, which may lead to aspiration. That's why education is very important for the mother, and also while you're giving this expressed milk for the baby, then position is very important. Next is the bowel obstruction. If you notice any bowel obstruction, you have to place the infant in supine position with head elevator, and baby should be in the nil by mouth. That is, baby should fast, and you have to start your IV fluids, and also the NG feedings can be given for the patient to identify where this obstruction is actually. Next is the abdominal defects. For a baby who are having an abdominal defects, so you need to wrap and support the abdomen, because when you have abdominal effect, so sometimes the baby having umbilical cord, so this umbilical cord, the organs will be exposed outside. So if it is exposed outside, there is a chance of catching many infections. So to prevent those things, you need to wrap and support the abdomen of the baby, and to prevent any occlusion for the blood vessels. And you need to monitor the blood pressure, check the GRBS, and you have to monitor closely, and temperature should be assessed for the baby, because there is a chance of infection and also sepsis for this baby who are having these defects. So this is how a nurse has to manage based upon the defect of the baby. Thank you. So any queries regarding neonatal assessment? Please post it in the comment section. Thank you.
Thank you so much, Yojana. That was really an amazing presentation. I think you have made us to gone through about complete detail about the head-to-toe assessment, also about the Apgar. Now, I welcome our expert panelist for the day, our Dr. Kiranmaye ma'am. The panel is also open for the audience. Like, you can post your questions so that we can address within our discussion.
Okay. So I just wanted to add some few points in the session. So examination of a newborn allows us to assess the baby's condition. So we can triage the baby appropriately and stabilize and give care as early as possible, and we can monitor the progress of the baby. And examining the baby needs an optimal time. So when we have to examine immediately after the birth, at 24 hours of life, and before the discharge. And also, whenever mother reports any concern to the baby, we have to address it. And the optimal place means well ventilated, the temperature has to be maintained, and bright and illuminated room should be there. And essential prerequisites, as already been told, that requires a thermometer, weighing scales, stethoscope, warm rooms, and everything. And before examining, a proper hand wash has to be done. And regarding the examination of a newborn, at 24 hours, you have to ensure that mother is able to establish the breastfeeding, baby is able to maintain the temperature, and also mother danger signs has to be explained to the mother before discharge. And we have to tell her the importance of subsequent follow-up visits also. And regarding the take-home message, any baby before observing, before examining, proper hand wash has to be there. It's a mandatory. All the findings has to be recorded and it has to be documented. And first is look, listen, and feel. That has to be interpreted and identify the symptoms, whatever it is, immediate care, if needs immediate intervention, address it.
Great. And one question from the audience, ma'am, how
Yes.
we can check for the congenital deformities if the child is with, if the baby is with, if the baby is a premature?
Congenital deformity, see, if it's a structural deformities are there, automatic, if a cleft lip is there, we can examine any spina bifida, see any congenital anomalies which can be observed clinically, we can assess. If required, if you are suspecting some inborn errors of metabolism, that has to be tested with the newborn screenings. That is the TMS, urine for GCMS, exome sequences, all that things.
Can you just brief only one thing about if the score, and we get the Apgar score, immediately we will try to score them into severe depression,
Yes.
mild, or into the normal.
Yes.
In case if the person is, if the baby is with mild or in the severe, so for the severe depressed baby, immediate management, what would be that?
See, any baby, if you think that, see, Apgar score, see, depending on the Apgar score, we are not going to treat the baby. It
Yes.
is just for the prognostication purpose, means whatever interventions we have done, so that what was the score, means the score has improved with our intervention. So the main treatment will be therapeutic hypothermia.
Yes. Great.
So therapeutic hypothermia, depending upon the level, see, it depends upon the asphyxia. So the perinatal asphyxia will categorize into mild, moderate, and severe. So it's not upon the Apgar score. Apgar score, depending on the Apgar score, we'll just prognosticate. So depending upon the asphyxiating score, we'll be treating the baby.
Thank you, ma'am. And what might be the take-home message that you want to give for the neonatal nurses?
So proper assessment of the baby is required, and also whatever the findings have been observed, it has to be documented, and proper hand wash.
Great, ma'am. Thank you so much, ma'am. And this is for today. Like, yes, I think you have got a very crisp presentation. You can enjoy this, watching it even later after this webinar if you have missed watching this from the beginning. This is there also in our Yashoda Hospitals Facebook page. Please do visit there for any other updates. Thank you all. Stay tuned.